So welcome everybody. We're thrilled that you're taking the time to join us here today. My name is Rachel Justus, and along with Jilian Levinson, I co-lead the Woman2Woman Gynecologic Cancer Support Program. And we are thrilled to put together this panel discussion in honor of Cervical Cancer Awareness Month. We hope that it is educational and informative and interesting. We are really excited that we've been joined by two wonderful speakers. Nicole Theodore, who is a volunteer with Woman2Woman, and Travis Thomas, who is a survivor of cervical cancer. And again, we thought this was a really important panel. There's a lot of information on the medical implications of a cervical cancer diagnosis, but there's not as much out there on the psychosocial implications. And that's what we're going to be focusing on today. We're going to be talking about the impact emotionally, spiritually, mentally, cognitively, in terms of getting this type of diagnosis. Before we get started, we just wanted to let anyone who's watching and is not familiar with Woman2Woman know what our program is about. We are based at Mount Sinai Hospital, and our goal is to support women through their gynecologic cancer journeys however we possibly can. We do that through a very robust peer mentoring program. We also have a big calendar of online support groups and educational webinars that we are always looking for people to join. We provide resources, including financial resources, cover things like household bills, mental health treatment, etc., for women who qualify. And the goal is to just make women that are facing any gynecologic cancer diagnosis, not just cervical cancer, know that you are not alone. You are part of a community, and we are here to help however we can. So why don't we get started and jump right in? We're going to start by having the speakers introduce themselves. So Jilian, would you like to start out?
Hi, I'm Jilian Levinson. I am Rachel's partner at Woman2Woman, and I have been an oncology social worker at Mount Sinai for 11 years.
Thank you so much. Nicole.
Hi, everyone. My name's Nicole. I'm a volunteer at Woman2Woman since 2018, and I love the organization, and I'm really happy to be here.
Thank you. And Travis.
My name is Travis Thomas. I am the National Cervical Cancer Coalition chapter leader for the Bronx and Harlem, the founder for Safe for Life Cancer Corporation, S4LCC Cancer Research Station, and a 3-time cervical cancer survivor. And I'm happy to be here. Thank you.
Well, thank you so much. We're so appreciative that both Nicole and Travis are joining us to share your personal and professional experiences. It's going to be really, really interesting and informative. So again, as I mentioned earlier, the goal of this panel discussion is to focus on the psychosocial implications and maybe common reactions that are experienced by patients at 3 different stages in their cervical cancer journey. So we'll be talking about what it's like to receive the diagnosis of cervical cancer, what are some common emotional reactions during treatment, and then also some things that women might go through upon completion of treatment. So why don't we start out by asking Travis. Travis, upon diagnosis, when you were first diagnosed, as you mentioned, you've been diagnosed 3 times, what was it like to be told that you had cervical cancer, and how did you feel at the time?
Wow. Just hearing the fact that I could possibly have cervical cancer in my 20s was just so overwhelming. I literally passed out, not once, but twice, because I couldn't believe that, that me at such a young age, that this could possibly be happening to me. It was devastating. It was life-changing. It was unbelievable, really was. I believe that was one of the worst moments I've ever had in my life. And I thought I was going to die. Mm-hmm.
And so what did you do? That's a lot of emotions to be feeling, and obviously really appropriate given the news that you just heard. So what did you do with those emotions? What did you do next?
First thing I did was I thought about my family. I thought about my children, my husband. How was I going to tell them? And then I asked them could you just, explain it to me? But even then, I was so numb that it was really going in my head and right out. You know, I wasn't really there. It was almost as if it's like you're like a state of being paralyzed and not knowing what to say or who to ask for or what resources are available. I was totally just, not sure of what I should do. This has never happened to me before. But they were patient with me. They were, open for any questions that I had, but I didn't know what to ask. Besides, what should I do? What can I expect? And what does this mean? And there wasn't no resources. I'm a 26 year survivor. Okay. And diagnosed, with cancer while pregnant twice. And back then, there was no resources really available that we knew about. So I couldn't even really ask for, is there a support or is there, somebody else I can talk to that might be going through this? So I really just asked, can you help me to get home? And is there anybody else I can talk to? But even with the talking, I was still really just lost. I didn't understand what it really meant. I just thought I was going to die. That first diagnosis, I just thought I was going to die. I didn't know who else to ask or anything,
Well, that's really, really powerful. And I'm sure that a lot of women who've been diagnosed with cervical cancer can relate to those feelings of being in shock and being overwhelmed and just, as you said, paralyzed, not knowing at all what to do next, not even knowing the right questions to ask because it was so out of the blue. So I think that what you said is probably relatable, to anyone watching this who has been diagnosed. And I know you said that was 26 years ago, but I think people diagnosed, this week probably feel the same way because again, you don't know what to ask for or what resources are out there because it's such new information. And so thank you for sharing what an emotional experience that was for you. Nicole, as a volunteer with Woman2Woman, can you talk a little bit about what your experience has been like volunteering with women who are undergoing treatment? And what are some common reactions and concerns that you see with women while they're undergoing their treatment? And also, if you could let us know what inspired you to become involved and to share your experience as a volunteer.
Yeah, it's a great question. And I think just going off of Travis's story, which Travis, thank you so much for sharing everything, and congrats on your survivorship. I think going through treatment, right, it's this, hopefully at that point, patients often feel like they have a roadmap, right? They kind of know the steps, but there's still this unknown that they're navigating, right? Like, how will treatment impact me physically? And then how will those physical components impact me psychologically, right? Working through nausea and fatigue, it impacts us psychologically and spiritually too, because it often means when I've worked with patients that they don't get to do the things that they love to do, whether that's be with their family in the way that they know that they can be, whether that's in their careers. And I think it really also speaks to how patients can have the same treatment, but depending who they are and how old they are and where they're from, it can impact them differently. And so I think what I've seen is really just trying to approach the women I work with from wanting them to tell me what the experience is really like for them. Because even if it's the same chemo or the same radiation, you just don't know how it's impacting them psychologically. And I think too, like the practical is emotional, right? Like getting to and from treatment can create a lot of emotions. It speaks to sometimes if there's issues in your support system, or I've encountered women who are mostly doing this alone. And as also a cervical cancer survivor, and like Travis, I was diagnosed in my 20s. I didn't live near my family, and that was really hard. And so I think there's also too this navigating stigma and what people think you should have as a person diagnosed with cancer, and so that can be really challenging. And so a lot of those things is what inspired me to volunteer with Woman2Woman. Like Travis, I didn't really know who to talk to when I was diagnosed. It wasn't even something I And I also was dealing with my own shame and discomfort around it. Cervical cancer, a lot of people don't talk about some of the stigma that's attached to it, right? And that's a shame. And so when I first found out about Woman2Woman through my oncologist at Mount Sinai, I really was taken aback that there was this community for me, and to be able to meet women like me who are dealing with gynecologic cancer. And the other component that I think really inspired me to volunteer is which I know we'll go into eventually, is this aspect of survivorship. I often feel like once my roadmap was complete, I was like dropped off into the abyss, and navigating that has been challenging. And as grateful as I am to be in survivorship, it can often be lonely. And it's also what inspired me to eventually become an oncology social worker as well, to try and fill in the gaps. But treatment is such a difficult time for some women, and so it's been an honor to walk through treatment with the women I've been able to meet, and it's been an honor to know that there's an organization like Woman2Woman out there.
Thank you so much, Nicole. That was a great plug for Woman2Woman, much better than Jillian or I could possibly have done. I think that you highlight so much. Both of you were in your 20s when you were diagnosed, which is young. And I think, Nicole, you also touch on some of the complicated emotions. Maybe there's some shame associated, I guess definitely for women of different ages, below the belt is not an area that you're so used to talking about in open forums, and you also may not know anyone that has gone through this before, whereas there are other cancers that are much more common. Most people know of someone who's gone through breast cancer, whereas cervical cancer, is not as common a cancer. So you also might only know the statistics that you see on the news, and those can be super scary. And so I think the idea of knowing where to turn for information and resources is so helpful. And I think your point, Nicole, that once you're connected with a treatment team, I like the word you used about a roadmap, that it kind of gives you a roadmap at that point. It's not what Travis was saying, where you feel like you're completely alone and don't know who to talk to, who to ask questions to, kind of what to do next. You're given this roadmap, and so you're put on a path that you can follow, and you have call this number if you're having these symptoms or if you have these questions. And I think that can be helpful, but I think you also really highlight the fact that no two women's journeys are the same in terms of their treatment, in terms of their side effects, in terms of whatever emotions they might be feeling. And so it's really important to address those individual reactions, and also make sure that women know whatever they are feeling is appropriate and it's okay. Let's turn to Jillian right now. Jillian, as it was mentioned earlier, there are a lot of psychosocial issues that might be associated with ending treatment, and some of them might be quite surprising if women don't expect them. So could you talk a little bit about some of the common issues that women with cervical cancer might go through, or that you've seen people go through at the end of their treatment?
Sure. So post-treatment can be a very challenging time for women. And as Nicole said, the term she used, that some could feel like they're being dropped into the abyss. During treatment, women could feel comfortable. They're seeing their healthcare daily. Women who are in radiation go every single day. They're checked. Radiation is often used for cervical cancer. And so that common checking in, having lab work done, seeing their team can be really comforting. And the end of treatment, is a wonderful thing, but that comfort and that check-in is gone. And women can feel really lost. They don't have that roadmap that Nicole so perfectly described. There is no roadmap to post-treatment. They say goodbye to their healthcare teams, and then they're on their own. Feelings of anxiety and depression are very common during post-treatment. And I think that's something that we don't really speak about or shine a light enough on. Oftentimes during post-treatment, families are ready to move on. They're ready for their partner, their mother, their sister, their friend to be back at it, going back to work, doing the duties that they might have at home, but physically or emotionally, the woman might not be ready to do those things. the woman might not be ready to go back to work. Her ability might have changed, might not be able to return to the workforce, or if returning back to the role that they had. That has emotional implications, that has concrete financial implications. In terms of also thinking about in terms of like home life, partners might be ready to be intimate, and a woman might have fear of pain or that intimacy. And that can be really challenging. And I think, again, that's something that as a society, we really don't shine enough light on or prepare women for after their treatment. Something else I think that we probably don't talk enough about for post-treatment is body image, self-esteem. For women with cervical cancer, they have major treatments. They have radiation, they could have surgeries, they have chemotherapy, they've lost body parts, they have scars. They're not the same woman that they were before their diagnosis. And I think we're really not preparing women, their families, for that emotional implication. As I mentioned, fears of depression and anxiety are common. And we really think as a program, as a community for our gynecologic cancer patients, we should prepare women with cervical cancer for that when they're done with their treatment.
I think that's really helpful. And again, I think a big goal of this panel is to show women some common emotions that other patients have gone through in the past, to make sure they know it's normal, so that they're not surprised if they feel what you were just saying, these feelings of depression, anxiety, all of that.
One other thing I'm going to jump in, because how could I forget this, is also fear of recurrence. And I think that goes into hands in hands of not seeing their healthcare team. They're seeing doctors every day, having lab work done, and then all of a sudden they're not. And that fear of their cancer coming back is tremendous. And that is a major aspect of post-treatment.
Absolutely. And I'm so glad that you brought that up.
Yeah.
Something that we've heard so often is that once you've had what Travis, described, this kind of bolt of lightning from the blue, this complete shock, a lot of our women that we work with, anytime they have any sort of ache or pain, you automatically jump to assuming it's the worst, because you've had the worst news given to you. And so I think that that's something that follows women for a very long time, not just in the immediate post-treatment phase, but for years and years, as we've seen in the various groups we run.
Absolutely.
Yeah. I think, again, this is a time to make an additional plug for Woman2Woman and just let people know that not only at Mount Sinai, but that through the Ovarian Cancer Research Alliance, Woman2Woman has been replicated in hospitals and community centers throughout the country, so that any woman watching this could have access to either a peer mentor, and again, that would be somebody like Nicole, as she described, a survivor who is using her own experience to help support and guide women through the beginning part of their journey. And that can look like whatever they want it to look like. It can be phone calls, texts, emails, Zooms, live meetings, depending on where the person is located. So again, if anyone is watching this and feels they could benefit from a peer mentor, do not hesitate to reach out so we can help you get connected either through Mount Sinai or through one of the other sites. And again, as I mentioned in the beginning, Woman2Woman really has a wide variety of resources to support both emotionally, financially, educationally. And Jillian's going to actually talk a little bit more in detail about resources specific to Woman2Woman.
Sure. Woman2Woman has 37 survivor volunteers at Mount Sinai. Our volunteers are different ages, they're different backgrounds, they're different socioeconomic status, races, religions, speak different languages. But their one commonality is that they are all survivors of different gynecologic cancers. Some have experienced recurrences, some have had multiple cancers, but they are there for all of our Mount Sinai patients to provide one-on-one support. They are happy to meet in person if comfortable. They're able to talk on the phone, email, text, about whatever a woman in treatment might want. So that could be around the diagnosis, symptoms, coping with the physical symptoms, the emotional implications. They're there. If one-on-one support is not for someone, if that's not what a woman in treatment wants, we also offer a lot of group support. Each month we offer about 13 groups a month. It's on Zoom, and they range from educational to supportive. Some educational groups examples are gynecologic oncologists talking about immunotherapy or treatment side effects, sex after a gynecologic cancer. We also have a group for long-term survivors, women that are post-treatment, and now what? We have a group for women living with recurrences. And so that calendar changes monthly, and we really try to make the groups what our patients need. We recently started a monthly Spanish-speaking group and a group for the LGBTQ A+ community that we're really excited about. Woman2Woman is proud to provide financial assistance. So we'll cover things for out-of-pocket costs like transportation or co-pays. We have a separate arm that we cover for mental health support. So if someone has a therapist, we will cover sessions with their therapist. If someone doesn't have one, we have contracts with 5 oncology social workers, not Mount Sinai employees, private therapists who are oncology social workers, and we'll pay for sessions with them. Our goal is to make sure that we're supporting a woman wherever we can. So if it's the peer support, the education, or the financial, we want to be there for our patients.
Thank you so much. And we do hope that people that are watching this decide to take advantage of some of these amazing resources that are available. So what we'd like to do now is we'd like to ask each of the panelists the same question. If there is a newly diagnosed woman watching this right now, what is your one most important piece of advice for her? Travis, would you like to start?
Well, for me, as a 3-time survivor, but as a cancer coach and an oncology patient navigator, I would definitely suggest that if you're newly diagnosed, that you ask to speak with a social worker and a patient navigator to get, and why that's so important. And we didn't have that back when I was diagnosed in 99, that to be able to get the resources, the information, the assistance, the support, and also to find out about community organizations that can help as well. And I think that that's a huge part of it, not walking away without getting the information and the support and the resources that you need. It's very, very important. And as our Saved for Life Cancer Resource Station, being connected with patient navigators in the hospital, as well as outside of the hospital for resources within your own community is very, very important. So I think that huge connection will help you to be able to get through your survivorship and your cancer journey, all at a very, very collective experience. You know, you don't have to worry about being alone. You got support on the outside, you have support on the inside of the medical facility, you have support with family and friends, hopefully, but you're well-rounded with all the support and resources that you need. So I think that is really important. If I had to do it all over again, I wish there was a program like Woman2Woman around, you know, when I was diagnosed, but I didn't know about you. So thank you so much for what y'all are doing. We really appreciate you.
And thank you so much, Travis. That is really, really amazing, helpful advice. And again, Travis is a great example of somebody who has used her 3-time cervical cancer diagnosis to be helping other women. Again, Woman2Woman is just one organization that's doing this type of work. And Travis has access to navigators and a lot of other resources. And the fact that you've taken your own experience and are using it and channeling all of your efforts to help other women who are newly diagnosed shows what a special type of person you are and what a supportive community this can be. So thank you so much, Travis.
And definitely come to, you know, check out the National Cervical Cancer Coalition, our website as well, because there's information and resources on there too.
Absolutely.
Thank you.
And it's also really important, as you mentioned, that, you know, we do not recommend just randomly Googling things. Sometimes that can have a very adverse effect, but a reputable website that has been recommended, you know, by a healthcare professional like the National Cervical Cancer Coalition is a very, you know, appropriate place to start. So thank you.
Thank you.
Nicole, what would your one most important piece of advice be for a woman who's newly diagnosed with cervical cancer?
Honestly, I have to say Travis just gave the best answer. I do have one more, but I have to just echo what she said because it's so important. I remember a social worker walked into my hospital room and I wanted nothing to do with it. And I think about that moment all the time. And it's actually really interesting. Now, as also a social worker, like, one, I respect that boundary. But two, I wish, just thinking about, even if it's someone you don't want to talk to, just why reinvent the wheel for resources, right? Have someone help you find things that exist so that you don't have to spend energy doing that. And that is actually my piece of advice, is thinking about like your energy. How during this time when you're diagnosed, who are people who give you energy back? What are things that give back to you, things that you like to do? Because as you often patients find, and as I found when I went through treatment, your circle gets smaller because it gets hard to update people, and you might have boundaries with that, and that might be really hard to figure out how you communicate with people. What are things that bring you joy? And so my piece of advice is think about how the ways in which you want to bring energy to you, like, throughout this process, and just know that it's normal to make your world a little bit smaller during this, and that it will expand again. But you need to do what you need to do to get through this time, and that's okay. And I think a lot of times I had to do that, and in the moment I thought I was doing something wrong because I wasn't talking to my normal network, but that's okay.
I think that's really, really helpful advice. And I like the way you just ended with "that's okay," because I think that's a really important message. Whatever feels right to you is okay. You want to go out and socialize all the time? That's okay. You want to be surrounded by people? That's okay. You want to, really just have a few close folks around you? That's okay. And I think that's one of the main goals of this panel, to show that whatever that reaction is okay. So thank you so much, Nicole. And Jillian, what would you say to the newly diagnosed patient?
It goes, it piggybacks onto what you're saying about it being okay, because what I would say is be kind to yourself, be gentle. I think with a cancer diagnosis, it's very normal to have some self-blame. Like, I got this because I did X, Y, and Z. I ate this. I don't exercise enough. Any kind of behaviors, and be gentle to yourself, be kind. You didn't do anything, and look for support, as Travis and Nicole both said.
That's great. We're coming to the end of our panel discussion. There's been so much helpful information shared by all of you with very different but overlapping perspectives, as you can see. I wanted to just kind of summarize, what we've spoken about, and then just end by sharing, how to reach Woman2Woman if you'd like to know more information. So I think that, again, this panel, the purpose of this was to show common reactions from a psychosocial perspective at each phase of a cervical cancer journey. And we hope that we were able to do that, to hear about the shock and, potentially feeling paralyzed in the beginning, to be on a roadmap and have a plan, but to still feel a lot of, anxiety and stress while you're going through treatment, and to potentially feel depression and almost abandoned, at the conclusion of treatment, which is quite surprising to so many women who kind of aim for that day. We've also given everyone watching some really tangible advice, some specific things to do upon being diagnosed. But the most important takeaway that every single person who has spoken is saying is that you are not alone. There is a community out there, and if and when you are comfortable, please join a community, Woman2Woman or otherwise. If you would like to know more information about Woman2Woman, they will be displaying this on the screen, but I'm just going to say our website, which is www.mountsinai.org/Woman2Woman. Again, www.mountsinai.org/Woman2Woman. And we are always happy if Woman2Woman is not the right match for you, or if you want additional resources, to direct you to organizations such as the ones that Travis was mentioning, or otherwise. Thank you to all of you for taking the time to be here today to share your very personal experiences, to share what you're doing in the cancer space and the cancer community right now, and to most importantly, especially to Nicole and to Travis, to give hope to women that are watching who might feel, as Travis said right away, oh my gosh, I'm going to die. To look at someone like these two beautiful women and say, these two women, are not only survivors but thrivers, and to see what they have done and are doing despite the stress of this diagnosis. And this is Cervical Cancer Awareness Month. And we hope that we brought some awareness to the cause, and we are all here for you. So thank you for watching, thank you for participating, and thank you to our panelists.
Thank you. Thank you so much.
Thank you.
Thank you.